Welcome to the first Speaking of Women's Health podcast. I'm Dr. Holly Thacker, the Executive Director of the nonprofit National Speaking of Women's Health. I am in the Sunflower House, and I am happy to bring you our very first podcast that shares credible women's health information. I'm going to tell you a little bit about the background of Speaking of Women's Health, and then we're going to discuss some women's health topics. For more information about Speaking of Women's Health and every women's health subject under the sunflower, you can visit our website at speakingofwomenshealth.com. Thanks for joining me, and let's get started. I became the executive director of Speaking of Women's Health in 2008. I first had live Speaking of Women's Health events to educate women to be strong, be healthy, and be in charge in 2002 when I opened a center for specialized women's health. And for several years, we did free health screenings and edutainment on all topics women's health. Speaking was founded by the quintessential woman, Diane Dunkelman, also known as Lady Di. And she gifted this program, which has expanded into a wide digital program, in 2008 when I took over operations. We have all the usual social media, Facebook, Twitter, Instagram, LinkedIn, etc. We have webcast, we have interactive virtual town halls, we have free treatment guidebooks, we have breaking health news, we have fun recipes, columns, and you can sign up for a free e-health newsletter once a month on our website at speakingofwomenshealth.com. We also have a free monthly health tip, and we bring you some of the leading experts in women's health, as well as functional medicine, as well as all the topics that women are interested in, from nutrition to exercise to weight management to beauty, to sorting through sometimes conflicting information. So please join us, not only for this podcast, but for our digital program. And we have information on all things that women are interested in, because most women, of course, are responsible for the health of their family and many times community and other relatives and loved ones. And so we do include free treatment guidebooks on children's health and men's health. And we have links to research. And another important part of Speaking of Women's Health is information for physicians and nurse practitioners, physician assistants, pharmacists, anyone who's involved in caring for patients. And we all will be a patient at some point in time. And optimizing your health and investing in your wellness is the perfect thing to start on January 1st, 2023, our very first podcast. We will also have a series of some podcasts that involve free continuing medical education for physicians, advanced practice providers, and others in healthcare. And this is all free and by unrestricted medical grants. Now, Speaking of Women's Health is a nonprofit, and it is supported by many, many generous donors. And one of our most loyal and long-standing donors and supporters is Building Healthy Lives and Clever Crazes, founded also by Lady Di, Diane Dunkelman. And I encourage you to check out clevercrazes.com for great information and games and empowering information for school children. So, getting on to our first podcast, I want to review and go over some information on iron, hair, and the female sex. This is from one of my latest columns on Speaking of Women's Health, and you'll find a vast array of physicians and nurses and anyone who is interested in helping to appropriately promote health and wellness. Guest column and authoring fascinating columns. So, on iron, health, and the female sex, throughout the female life cycle, there are special demands for iron. Iron is a mineral that both sexes need in order to carry oxygen throughout the body. Iron deficiency can lead to extreme fatigue, feeling lightheaded, as well as even a painful tongue and pale skin color. Menstruation, giving birth, and breastfeeding increase the need for iron across the female life cycle. Many times, low iron in women is blamed on the female life cycle. However, I caution women, even women with heavy periods who are over age 40, they still should be evaluated for occult or hidden sources of blood loss via the gastrointestinal tract, such as peptic ulcers, even stomach cancer, celiac disease, which is an intolerance to gluten, a wheat protein, colon polyps, and colon cancer. In fact, colon cancer has been rising in incidence, especially in young people. And the American Cancer Society now recommends average risk people begin screening at age 45, not the old age 50. And certainly people at high risk who have hereditary problems such as Lynch syndrome or other conditions or known precancerous colon polyps start even sooner. So how much iron do women and females really need? Well, our bodies need iron for blood cell development, brain development, and iron is actually integral to producing all the cells in the body. Menstruating women need a whopping 18 milligrams of iron daily. That's a lot. Postmenopausal women should aim for about 8 milligrams daily. Children between the ages of 4 and 10 need 10 milligrams daily as they're growing. And babies and toddlers who are rapidly growing as well many times outstrip their iron stores, particularly if they're not eating iron-fortified cereals and or red meat regularly. Infants between the ages of 7 and 12 months need 11 milligrams daily. And toddlers between the ages of 1 and 3, such as my lovely granddaughter Artemis Vera Thacker, they need 7 milligrams daily. On our website, you can see some really cute pictures of Artemis. And you can see how pale she is, which is from her low iron, as well as her hair, which is very thin. And she, like a typical female, does care about her hair. You know, a little side story. When I was seeing patients in our Center for Specialized Women's Health, I would see a lot of women who would come and see me because of hair thinning. And I was really kind of perplexed by this because I'm not a dermatologist, and I am focused on things like heart disease and cancer risk and osteoporosis and reducing Alzheimer's disease and staying strong and fit, reducing metabolic diseases, and optimizing the genitourinary system, which includes bladder health, the pelvic floor, and sexual function. And all of these topics we will go into in great detail in future podcasts. And we're also going to let you know when we have events where you can log on for free and interact with our women's health experts. In fact, we are planning some town halls on menopause and vasomotor symptoms. And the first one will be on February 16th, 2023 at 7 p.m. Eastern Time. So there'll be more on that, and we have all of this information on our website, and all of this is free to you, which will really pay off personal dividends to you in the future. So anyway, in terms of me being a little perplexed why someone would come to me for something that seems like a superficial cosmetic issue, I realized that hair is an intensely female symbol, and it marks femininity and beauty. And certainly not all women care about their hair. I'm not really particularly a hair girl, more nails than hair. But nonetheless, the hair is certainly a window into our health. And so when you're low in iron, you can't grow hair. So as a mother and as a women's health physician, and now being a Mimi, being blessed with a very active toddler granddaughter, Artemis, and I just had another grandchild, baby Lincoln, my grandson, who was just born right before Thanksgiving. And I thought that was such a great name to name him Lincoln, because it was President Lincoln actually that gave the proclamation proclaiming Thanksgiving to be a national United States holiday. And Artemis's mother, who is a nurse practitioner, she is expecting her second baby, another baby girl. So iron is definitely on my mind. So toddlers are actually the age group that tend to ingest the least iron. So when I noticed some pallor and hair thinning in my 2-year-old granddaughter Artemis, I started to think about her iron ingestion. And other than eating occasional bacon, which is not as high in iron as red meat, and of course, it's high in sodium and it's not always the healthiest food, it does actually, though, contain K2. And K2 is not K1, which is in green leafy vegetables. K2 is found in very few foods. Now, it's very richly found in Japanese natto. But other than that, there's only a handful of foods that have K2, which is very important for incorporating calcium into the bones. And extra calcium we don't want deposited in the arteries or the heart. And so bacon does have K2. So does pork, dark chicken meat, not the white. And there's a few cheeses, Swiss, Gouda, and Blue. And I love those cheeses. And I like to use bacon to flavor foods. But certainly not all people like these foods. And so, therefore, especially in women that are boosting their vitamin D intake, which, by the way, vitamin D is not a vitamin. It's a pro-sterile hormone. It's needed for all cells. A vitamin, by definition, is something that our body cannot make. So, if you're outside in the sun near the equator without sunscreen or clothes and expose your skin, you can synthesize vitamin D in your skin. Now, many of us live in northern climates and we don't get sun year round. And many of my patients actually live in Florida. In fact, I have a Florida medical license as well as an Ohio medical license. And if you're over 40, certainly over 50, a lot of times the skin doesn't synthesize it as well. And if you're inside sitting in air conditioning or using sunscreen, which many times we do recommend to protect your skin from skin aging and certain types of skin cancers, then you're not going to be making vitamin D. And we'll have more on vitamin D and the incredible health benefits on vitamin D in future podcasts. But anyway, getting back to bacon and the fact that Artemis really doesn't like to eat very much red meat. And unfortunately, after being a 1-year-old, she stopped wanting to eat iron-fortified cereals. Now, Iron-fortified cereals are very high in iron. Oatmeal has about 4 to 6 milligrams of iron per serving. Tofu and red meat are other good sources. So she, like many of us females, does care about her hair. And her favorite character is Elsa, the frozen ice princess. And she loves to wear her Elsa hair extensions. And on our website, you can see some cute pictures of her wearing those hair extensions. In the future, though, we may be doing some of our podcasting on Rumble, so be sure to join our Speaking of Women's Health Rumble channel. So hair follicles do require iron and protein for growth to produce strong, healthy hair. And one of the first signs of inadequate iron is poor hair growth. Blood counts and anemia happen after you deplete all iron stores, after all your iron is exhausted. So a lot of women I see tell me, oh, I think I have normal iron levels because my blood count's normal. But your blood count is the last thing to drop. And if you happen to be a regular blood donor, which is such an important gift, we periodically have severe shortages. And last year at this time was the worst I ever saw it in my medical career. So if you are losing blood or have extra demands on iron or are donating blood, then you really need to figure out and find out how much iron you need. So some tips to add iron-rich foods to your diet. If you've got picky eaters in your family, or if you yourself struggle to ingest enough protein in your diet, here's a few tricks and recipes that I have learned over the years being a mom doctor. Number 1, you can add fine ground red meat, a little bit of milk and noodles to make a creamy sauce with some spinach, because spinach and meat are very rich in iron. Now, you somewhat mitigate it, the iron absorption, if you put a lot of milk or cheese, because calcium somewhat impairs the absorption. And a lot of toddlers, like Artemis, love cheese, love milk, and that's great for their bones and for their calcium and protein ingestion, but it might be better served at a different time. You can slip spinach into pancakes, bake potatoes with sour cream, and you could also make a forest chocolate cake, putting dried, shredded spinach in the cake. I have done that for years, and my children never knew the difference. Chocolate, dark chocolate, also is a source of iron, and you can add cocoa powder to many recipes, smoothies, sauces.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
You can eat calcium-rich foods like milk and cheese, as I mentioned, at a different time. It is important to pair vitamin C-rich foods with iron to help in the absorption of the iron. So some examples of vitamin C-rich foods: oranges, kiwis, lemon, lime, squash, cauliflower, guava, tomato, and potatoes. In fact, tomato paste is a rich source of iron, more so than just a plain tomato or tomato sauce. If your physician prescribes an iron supplement, he or she frequently will add, take with a sip of OJ, meaning orange juice, or some high vitamin C food. Now, whole grains such as whole wheat, brown rice, and quinoa are also good sources of iron that also offer dietary fiber and B vitamins. Many toddlers enjoy fruit, but only a few fruits contain iron. So focus on raisins, dried apricot halves, and red tart cherries. Diced watermelon has about 0.36 milligrams in a cup, and prunes, which are good for the bowels, have about 0.36 milligrams per serving. So casseroles containing beans are a wonderful source of iron, and white beans are one of the richest sources of iron, offering 8 milligrams per serving. And if you can use cast iron cookware to increase the heme iron content of the meal. Now, there's 2 types of iron, heme and non-heme. So heme iron is only available via animal products such as meat and seafood. And if you're a vegetarian, then you're only going to be getting iron from non-heme sources such as fortified foods like cereals, or non-animal sources including yummy dark chocolate. I have a great column on dark chocolate, by the way. So some more iron-rich foods and their iron content. 3 ounces of dark chocolate, 7 milligrams. That's the toddler's recommended daily allowance. At least that's what I emphasize to Artemis's parents, who are kind of the chocolate police, when we started the Advent calendar over the Christmas season. And they said, oh, we're doing away with chocolate in the new year. And I said, well, I wouldn't do away with dark chocolate if you want to keep your iron levels up. 3 ounces of steak is 2.5 milligrams of iron, so not as much as you might think. 3 ounces of lamb, 3 milligrams. 3 ounces of a chicken breast is only 1.1 milligram, and we know a lot of children like chicken fingers, but it's really not as rich a source as, say, 3 ounces of chicken liver, which is 9.9 milligrams. 2 cups of cannellini beans, 4 milligrams of iron. 1 egg, which also has protein and choline, which is important for brain development, is 1.68 milligrams. Just a 1/4 cup of cooked spinach, which is easy to slip in so many things, is 2 milligrams of iron. 2 ounces of chickpea pasta is 3 milligrams of iron. 2 cups of raw tofu, 3.2 milligrams. And 2 cups of cooked lentils, 4 milligrams. That's excellent. Now, can you get too much iron? Yes. Occasionally, people can have iron overload, and they can have a condition called hemochromatosis. That occurs in about 1 in every 200 persons, and it's usually evident in males before females. Why? Because most females undergo menstruation, which is monthly iron loss. Although you don't have to have monthly periods, we in Women's Health have known about this for a long time, and this is now approved to do so. And so we'll cover that on future podcasts as well. And childbirth and lactation have huge iron demands on women. But before taking an iron supplement, it's really probably best to check with your physician. The same goes before giving iron gummies to your picky toddler. Check with your pediatrician or your family physician. Now, with Artemis's parents' permission, I did try some iron gummies. And, if you put enough sugar on top of things, sometimes that helps the medicine go down. The medicine go down. The medicine go down. But singing and little tricks like shoving the iron gummy in a Buckeye peanut butter chocolate, many times it only works about 1 time. So it is really important to try to get your nutrition from food sources. But sometimes when you can't, it's nice that we have supplements. And speaking of supplements, you really want good quality supplements, and you want to make sure that they have what they say they have in them. When I see patients in the office, I often will ask that people come with their supplements, not just their prescription medicines, not with a list, not saying, look in the computer. I'm taking what's in the computer, because there's so many different steps for errors. And I also like to look at the bottles for expiration dates and the lot number, because if there is some sort of contamination, it is important to be able to track it. And I'll be interviewing some women's health functional medicine experts who prescribe a lot of supplements and botanicals. and have a lot to say about purity and safety. So, before taking anything over the counter or prescription, of course, you want to consult with your physician in order to be strong and be healthy and be in charge. And that is our Speaking of Women's Health motto. So some of the associated columns that we have associated with this iron and hair and the fairer sex include links to our free treatment guidebook on hair thinning, list of foods high in iron, a nice column on combing through hair loss, and hair loss is not a problem for just dear old dad. Hair loss, what's a woman to do? Women's health and celiac disease. When I see women with low iron, I don't just attribute it to heavy periods, having babies, and breastfeeding, even though those take a lot of iron out of you. Sometimes there can be occult problems such as celiac, which can also lead to osteoporosis. And I've had patients in my practice that simply by taking out the offending protein, the gluten, they improve and normalize their bone density and their iron levels. Women who are low in both vitamin D and iron, many times it's just from poor intake. However, it could be celiac disease. Low iron can cause restless legs, which can be very bothersome at night. And there's a lot of new therapies that offer hope for minimizing hair thinning in midlife and beyond. And whenever you're preparing for any kind of hospitalization or surgery, especially a major surgery that might entail some blood loss, such as hip or knee or major joint replacement, it's really important to boost those iron levels. And one way that you can tell or get a handle on what your iron level is asking your physician for a ferritin level. Now, ferritin is also a marker of inflammation. So your level may be high not because you're too high in iron, but because you have too much inflammation. So it's best to check it not during an acute febrile illness, but when you're at steady state. If your ferritin is too high, then your physician may want to check your iron ratios. And certainly if your levels are really low, below 50 to 70, we tend to see a lot more fatigue, which is a common problem in women, as well as hair thinning, if those levels are below 50 to 70. And a lot of dermatologists like to shoot for that level. If your level is very high, or you have a family history of hemochromatosis, which might manifest as joint disease, cirrhosis of the liver from scarring because of iron deposition in the liver, even pituitary problems, any kind of iron infiltration extra in the body is not healthy. Then there are some genetic tests to see if you are at risk for hemochromatosis or maybe are a carrier of it, and can give your healthcare clinician a better handle on what your risks are. And the treatment for iron overload is actually bloodletting or donating blood. Certainly in the past, bloodletting was done thinking that it would be helpful, and it really was not obviously helpful and was a ineffectual therapy that was very damaging to many. And so certainly medical science is evolving and coming along, and it's very important to look at research, and we'll be going over research studies. And like I like to tell my fellows, I've been in charge and directed a specialized women's health fellowship, which is a 2-year program for board certified or board eligible physicians to specialize in specialized women's health. And as such, I always describe research as just being a piece of the puzzle. It's not the whole thing. It's almost like a biopsy. If you have a biopsy of something in your body, it gives you a sample of the tissues, but it doesn't necessarily always give you the full picture, or it may not be all the information that your physician needs. So it's an important look into the body, but it may not be the whole story. So as I mentioned, I founded the Center for Specialized Women's Health, as well as the fellowship, which I've been directing for over 25 years. Actually, I started it when my third and youngest son was born. I was just a couple days postpartum in getting all the details ready. I've also authored a few books, The Cleveland Clinic Guide to Menopause and Women's Health, Your Body, Your Hormones, Your Choices. And I have a lot of interest in areas of research and expertise, including menopause, perimenopause, related medical problems, including osteoporosis, which affects 1 in 2 women over age 55, hormone therapy, including so-called bioidentical hormone therapy, breast cancer risk assessment, treating women who are breast cancer survivors or those at very high risk for breast and gynecologic problems, such as the BRCA disorders and many others, female sexual dysfunction, and just to focus on interdisciplinary women's health. Women have different pharmacogenetics, pharmacodynamics, many times different manifestations. Classic symptoms of heart disease do not manifest so-called classically in women as they do in men. In fact, one of my first publications was to the New England Journal of Medicine, a letter to the editor, because I was very miffed that they published some guidelines that were not gender specific. And it's taken decades to finally get to that point. And I'm really happy that the last American Heart Association guidelines on cardiovascular risk assessment did include some gender specific information. So I hope you've enjoyed this little peek into what's to come on this podcast. And I really want to thank you for joining me in the Sunflower House and for listening. And if you've enjoyed this episode and you want to help support the podcast or our nonprofit, please share this with others. You can also donate to Speaking of Women's Health on our website, speakingofwomenshealth.com. You can also please leave us a 5-star rating and review. That helps us get up in the ratings. And to catch the latest from us, you can subscribe to the podcast on any place that you listen to podcasts, whether it's Apple Podcast, Google Podcast, Spotify, Stitcher, TuneIn, iHeartRadio, or radioinfluence.com. So thanks so much. Remember, be strong, be healthy, and be in charge. And I will see you back in the Sunflower House next time.